Thank you. And Madam Clerk, would you read departmental item number 4 into the record, please?
Chair Hartman and members of the board, departmental item number 4 is from the County Executive Office. It is a hearing to consider recommendations regarding an update on the coronavirus disease 2019, COVID-19.
Thank you. And Dr. Del Reynoso?
Good afternoon, Chair Hartman and members of the board. With me here this afternoon is Dr. Ansor to provide our COVID-19 update. I'd like to begin my COVID-19 update with recapping key elements. Madam Clerk, may I have my slides? Next. So we began roughly 2 years ago. On March 11th, 2020, the WHO declared COVID-19 as a pandemic, and we started hearing, though, reported cases around the world a little bit before then. So it started with December 31st, 2019. We heard about cases coming from Wuhan, China. We began hearing cases in Europe beginning January 24th. Here in the US on January 20th, we heard from CDC that we have our first case. In California, our first cases happened on January 26th. And here in Santa Barbara County, March 15th marks the first date of our first case. So today marks the second anniversary of our first case. And, you know, this is a date that I think I will always remember because I recall celebrating my niece's Kathy's birthday, texting her to congratulate her birthday, and then also getting notice that, Ovan, we have our first positive confirmed case. Next. This is the recap of our case rate in Santa Barbara County. So we began our first peak on July 11th, 2020, with a case rate of 26.2. Then we, on August 28th, 2020, we were assigned the purple tier as the state implemented its blue tier system. We saw then our alpha peak on 1/8/21 with 100 cases per 100,000. And then in the subsequent months, we saw a rapid decrease. And then on June 15th, 2021, California fully reopens and the state retires the blueprint tier system. Our case rate at that point was around 1.1 per 100,000. And then we began to experience the Delta surge a few weeks later with the Delta peak on August the 14th at 31.3 cases per 100,000. And it lasted through the fall. We really never achieved that that low case as we did from the alpha peak. And then as we entered, excuse me, as we entered December 2021, we began to see the Omicron surge occur incredibly at a fast clip, with the Omicron peaking on January 10th, 2022 at 258.1 cases per 100,000. So where we're at now, we are seeing a 4.4 case per 100,000, and that case rate has been decreasing 69% from the last 2 weeks. Next. This is a recap of our hospitalization rates, mirroring the peaks that we saw in the preceding slide. Our first peak we saw in July 20th, 29th, 2020, with 89 cases. in the hospital, with 31 of them being in the ICU. Then we saw the alpha peaking on January 12th at 2021 at 211 cases, with 60 being in the ICU. So what we're seeing here is roughly the peak in the hospital, in the hospitalization, roughly about 1.5 to 2 weeks after the case peak. We saw the Delta peak of, we saw hospitalization due to the Delta peak on September 1, 2021 at 82 cases, with 24 being in the ICU. And with the Omicron, we saw it earlier in January 21 at 150 cases, with 29 in the ICU. We are currently at a low of 19 hospitalization, with 2 in the ICU. Next. This slide talks a little bit about our vaccination rates. So on your right is the graph of our peaks and ebbs with regards to vaccination in our county. We started in December 1st of 2020 with 8 doses. That was our dry run. And then we began ramping up and seeing the high point of vaccination in our county happening at 8,491 in March 31st of 21. And then we saw a dip and really not seeing an uptick again until last December, when we saw the peak at on December 2nd with 3,952 cases doses documented. We are currently documenting 162 doses given in our county as of March 13, 22. And on the left-hand side is our recap of our vaccination status. We have 67.7% of Santa Barbara County fully vaccinated as of March 13th. 72% of our eligible population is fully vaccinated. Next. This is our breakdown of vaccination rates by zip codes, and we are continuing to focus on the zip codes with red and orange, and really want to point out here that we really note the incredible work in the 93434 zip code. That's Guadalupe, the 93454, the Cuyama zip code, and the 93458 Santa Maria zip code. We're seeing significant traction in these zip codes with regards to vaccination rates being increased. And this is really due to tireless efforts by community partners. Next. This is a list of vaccine partners, our community partners who have received vaccine grants from the state or our local critical needs fund. And it includes really a diverse group of partners, ranging from healthcare partners to community organizations and to community organizations, community-based organizations. This list is not comprehensive because it doesn't include the additional partners that all these funded organizations partner with in order to do the outreach. Next. So that brings us to the current status in Santa Barbara County. Currently, we have 13 new cases, and that is a decrease of 61% from 2-week average of 33. We are seeing 171 active cases. And again, this is also a decrease from a 2-week average. Our case rate per 100,000, as I mentioned earlier, is 4.4. We have 2 new deaths. And both individuals were 70 years of age and had underlying health conditions, with 1 death associated with a congregate care site. We have 19 hospitalized, with 2 in the ICU, and our total deaths stand at 664. Our testing positivity is at 2.2. Next. This is a good summary of where we're at with indoor masking. So for the vaccinated and unvaccinated, as you are aware, the state has lifted most of the requirements for indoor masking, except for healthcare, long-term care, jails and prison. And as you are also aware, the federal mandate for masking stands for public transportation at least until April 18th. However, we are still strongly recommending that everyone consider masking when they are at a public indoor setting and at schools and childcare. Next. The local public health department has been thinking through our strategies and our goals for the next phase. And I'd like to share with your board the next 4 slides about our best thinking thus far. So with regards to vaccine, moving forward, we will maintain our mobile vaccine program, especially in health equity areas and in vulnerable communities. We will continue to monitor immunization trends via the database and via epidemiology. We will continue to support our healthcare providers and systems to build their capacity to vaccinate individuals. And we will also consider seasonality of surges and make sure that we plan for those trends and be ready to increase our vaccine clinics if needed. With regards to isolation and quarantine, we will increase capacity within the community to be able to conduct isolation on site. And we have started that work with our homeless shelter partners. We will maintain the flexibility in our C19 team so that they can expand and contract their scope of work and be cross-trained to be able to provide all aspects of the current work, which includes vaccine offerings, isolation and quarantine, and testing. Next. With regards to testing, we will encourage the utilization of state and federal programs for ordering tests as the main mechanism for service to, especially in rural or isolated communities. And we are working currently with those communities. We will support our partners to retain their own cache of antigen tests through already existing mechanisms. We will maintain testing supplies for surge and outbreaks. With regards to contact tracing and contact investigation, we will transition our contact tracing contact investigators to respond to detailed inquiries from the community, businesses, and congregate living facilities. We will publish a public phone number to support anyone who tests positive and needs additional support or guidance. We will enhance capacity of our 211 partners to provide detailed support to those who call 211. And we will shift our contact investigator, contact tracing team to outbreak response function, meaning to support travelers to look at congregate outbreaks in congregate living centers. Next. With regards to data and our local dashboard, we will be transitioning to rely on CDPH data sources after expiring our local health emergency order. We will maintain capacity, though, to resume processing and reporting local data if a surge occurs. We will streamline our dashboard to contain key metrics. With regards to surveillance, we will be monitoring federal and state data sources and trends. We will maintain our engagement with local and state partners for wastewater, and that should read variant monitoring. Next. Our last set of strategies involve our healthcare centers. We will maintain testing at our Lompoc and Santa Barbara healthcare centers at least through 2022. We are ramping up and building the capacity at our Santa Maria Healthcare Center in anticipation of the community testing site at Santa Maria Fair Park closing. And I just heard from the state that they will support us with community testing until June 30th this year. We're also looking at developing capacity at our Carpinteria Healthcare Center so that the Carpinteria community would have access to testing. Next. I'd like to end with this slide and acknowledging that we as a community have experienced twists and turns these past 2 years as all the other communities worldwide. Moving forward, we can expect that SARS-CoV-2, the virus that causes COVID, will continue to change and evolve, and we need to adapt with it. We can also expect that the strategies and approaches that we have used in the past may need to change as we adapt to the new variant. But we do have the tools with vaccines and booster. With high quality masks, with the availability of PCR and antigen testing, and increasing access to medicines and to antivirals, to monoclonal antibody as treatment options. These are the 4 strategies that really will build our capacity as we move forward to fight COVID-19. And with that, I'm concluding my briefing, and Dr. Ansorg and I are open for questions.
Any questions? Supervisor Nelson.
Yes, thank you, Chair Hartman. Just a question about, so we've built the infrastructure to react to the pandemic response. Funding moving forward, what is that going to look like for the department as some of this COVID relief funding wraps up from state and federal sources? How will your department look moving forward?
Supervisor Nelson, through the chair, that's a great question. CDPH and CDC has acknowledged that the infrastructure of local health departments needs to be strengthened, needs to be bolstered. And so we have received fundings from both CDC and CDPH to bolster our infrastructure, increasing our data capacity, increasing our technical capacity, our communication, our staff training, our building our community relationships to partner up with us at the next response effort. So all of that we have been working on, and we will continue to work on. And these fundings will last anywhere from 1 year to 3 years.
Thank you.
Any other questions or comments? Supervisor Williams.
Well, I think sometimes when we get to this point, we don't pause for a second and number one, thank all the people who worked to make less people get sick and worked to make fewer people die, and I think it's important to celebrate that. I think it's also important to celebrate being at this moment in society. I don't think we should conclude that things are over, but even things being better and being able to get back to more community activities is a great weight off of many people's shoulders, psychologically, in some cases, economically, and others. And I do think it should be a moment of gladness. I'll be a lot more glad when there's no one else who ends up dying between one of these reports. But I still think the level of progress that's been made should be celebrated, and we should have some gladness and thankfulness in our hearts.
Very well said.
Well, I was going to wait to having some closing comments because I didn't know if there was public comment, but I guess there's none. So,
For the record, Madam Clerk?
Chair Hartman and members of the board, yes, thank you. We have no requests to speak on this item.
Okay, thank you. I'm actually looking at this as this potentially is our last one of these, hopefully for some time. I think is the hope for this board, and so a lot of looking back at this last 2 years. My daughter this weekend mentioned that it's been a 2-year anniversary since she got the email saying that spring break would be extended. And, they were thinking for a few days, but obviously it was much longer. And it just reminds me of what the impact this has been on our youth. And I just think that that's really important for us all to remember that, some of the people that we're most charged with taking care of have suffered the most. Maybe they may not have had the sickness, the disease, or passed like some of our older populations, but I think we need to be all diligent moving forward with, the education gaps, with the depression, with the obesity. I mean, I think there are going to be some societal cleanup that needs to take place, and so I want to make sure that we're all thinking about that moving forward. Also, as this is obviously unprecedented, and that we were adapting as we moved. I'm hopeful in the future if we have public health emergencies like this that we're able to balance public health emergencies with local control and decision makers. Obviously, things are very dynamic, and many of us did the best that we could with what was in front of us. But I really, throughout this whole time, have struggled with the lack of the ability of this board and other decision makers to maybe help temper some of the big picture issues. I know public health, their responsibility is yes, broad, but also very narrow, especially when it comes to governing, and they don't have all the same tools that many of us do as electeds. And so just, those are kind of my thoughts as we hopefully are moving beyond this period.
Supervisor Hart.
Yeah, I want to just, I don't know where we are exactly in this moment in history. I hope we are where we want to be, and things are definitely getting significantly better. Appreciate the facts and information that Dr. Doronoso provided us with. And I do want to kind of reflect back, as Supervisor Nelson just did, about how hard this has been for everybody. I remember having a conversation with my more than 90-year-old ex-mother-in-law who said, I asked her, you've been through a lot of things in your life. You grew up in the Depression, you were a teenager in World War II, there's been, recessions and world strife through your whole life. How does this event rate in your experience? And she said very clearly, quickly, this is the hardest thing that's ever happened in my life. And she said it was because we weren't able to physically get together at the very beginning of the pandemic. We were isolated and apart. And in those other occasions, people could get together and they could celebrate and they could share the difficult moments and be with people. So this has been truly extraordinary, and we will never forget the past 2 years. As long as we live, we'll be telling our grandkids about this experience. I hope we've learned something from this. I'm not sure it's clear, what we learned, but as time goes on, we get more distance and space from this. I hope there's a robust discussion about, how we could have done better, what we needed to know when we didn't know it, and how, more importantly, how we can be better prepared, in the future. And that's our job, is to figure that out, work with the folks in the public health department and others, and be in a better place, because this is probably not the last time we're going to encounter something like this in our lives, unfortunately.
Supervisor Lavanino.
Thank you. That just brought up something, Supervisor Hart, when you were talking about that, is I think one of the things that we do need to take away is to be prepared. I remember going to get groceries like in that first 2-week shutdown and just freaked out, like, oh, wow, this is like apocalyptic. This is what all those movies are about, like when you're looking around and there's nothing on the shelves and people are, it was the first time you saw people in masks, and it was like, whoa, this is like post-apocalyptic, something really bad. But have I gone out and like stored up a bunch of food or anything? No, that's typical human beings, is we're like, oh, we made it through the rough part. So, I think it's incumbent upon all of us to, learn something from this. If we don't learn anything from it, then, we really wasted an opportunity. So, this thing's going to be analyzed forever, I'm sure, and how the human beings dealt with this. But I'm glad, hopefully, that we are looking at it in the review mirror.
CEO Miyasato.
Chair Hartman and board members, just to let you know, we are planning to come back in April, and we're looking at that, about a wrap-up, and given the public health statistics, talking more to Dr. Ansorg and Dr. Von Dorenoso about the end of the public health emergency, so we do plan to come back in April. We're figuring that out right now, and we do have an after-action report that's been done with our consultant on the emergency response. Right now, it's been focused on the non-public health part, because the public health response is so large. So we focused on that. We'll be coming to your board. So there will be time to do more of a wrap-up and have thoughts and reflections. But I do want to thank your board, and I want to thank Supervisor Hart, because I didn't agree with him. And that was, at the beginning of this, you decided that it was important for you to be in this room or in Betteravia Center, and Supervisor Adam as well, and that you continue to do that. And I want the public to know that this board has not had a regular meeting that was virtual. Although the board has passed a 30-day extension, it really hasn't related to this board. The board has always been in the Betteravia Center or this room holding these board meetings. We had a couple of maybe special meetings where we did all virtual. There were maybe some closed session items. But for any regular meeting, and I went and looked at different organizations that my friends work for, and they didn't do that. Some boards are still meeting virtually. And I want the public to know this board has made a commitment, at the beginning, and that's why I say I didn't agree with Supervisor Hart when he was chair, when he made that, but he was right. That it was important for the public to see you in here and for you to be governing from your positions together. So I want to thank you, because I think it has made a big difference in how we got through this pandemic. So thank you to all of you.
Well said. I think the 2-year anniversary is a time to look back, but as we've learned with all emergencies, there's a lot of things that play on into the future. So we're dealing with the economic and supply chain issues, and the Great Resignation. I think of the 10 people who retired in our organization just this month. And most especially, as Supervisor Nelson noted, the mental health. And yet, we were out there doing the surveys and getting the information and analyzing, or the after-action report. We begin to anticipate, even during the emergency, what's going to come next. How do we keep this county ship of state afloat? And so I'm appreciative to all the staff. I think of Dr. Del Reynoso and Dr. Ansorg, and this has been grueling, and the stamina that it takes day in and day out. And I'm so admiring of how they've dealt with this. I remember, thinking, I think we were trying to get to 7 cases, a case rate of 7, and it seemed impossible, and now we're at 4.41. And so I at least thought, well, maybe it's safe to take my mask off. But we've sure been through a lot together, and I think this board has pulled together with our staff and stood behind our staff. And I think that has been very significant in getting through this phase of it. And now we've got additional phases until we recover. So take a deep breath, and we got more work ahead. So we,
I move staff recommendations.
second?
Second?
All in favor, say aye. Aye. Any opposed? Passes unanimously. We are adjourned until Tuesday, April 5th.